decorations up?
We have a couple.
Oh,
My
all
wife
right.
is kind of Christmassy.
All right.
Nice.
So
Nice
yeah,
to be a
we've
little
got-
festive.
How about you?
We've got loads of decorations around.
That's good.
I think we're compensating from not going out east, you know. So, no, Linda has done a marvelous job of getting us in the Christmas spirit around here.
Very good. Yeah, that's the word I heard in Wisconsin.
We are
they
now
had,
live, just so everyone knows.
how about you?
We're live, so we can't
Okay.
give it anymore.
Thank you, Christina.
Right. It was good talking, John.
Yes.
Not going out, you know. So, no, Linda has done a marvelous job of getting us in the Christmas spirit around. And Dr. Martell is connecting to audio. I hear the turning of pages. I think you made it.
I just want to make sure Angie's there.
Well, we appear to have a quorum, so we can, I will make a motion to start the December 9th, 2020 Board of Health Finance Committee meeting.
Second?
Great, all in favor?
Aye.
All right, we are up and running. First order of business, I need an approval of an agenda. Do I have a motion?
So moved?
Second.
Thank you. Any questions? Discussion? If none, all in favor of the agenda, signify by saying aye.
Aye.
Aye. Opposed? Agenda is approved. We'll move into financial statements. Our resolution of expenditures, statement of fund balance, our financial review, and balance sheet at this point are deferred. We have our bank reconciliation, the general account, which is found on page, or they're all general accounts. The lead account, page 238. Our general balance, 94,424.66. We have our abandoned property account, which we found on page 5, our minimum balance $5,000. And we have our state of Illinois e-pay, page 8, which is $785,254.89. Does anyone have any questions concerning those?
No.
Jim, do you have anything to add to these?
No, we just, we did get our lead proceeds deposited for all of our efforts through the end of September, so that was good. It was our first draw on our new grant, actually,
Oh,
that we had back in March, so.
great. Just a 8-month delay. All right. We will move into the revenue and expenditure report, which is deferred. Our emergency reserve minimum graph also deferred, and our current accounts receivable, which is deferred. So we will move on to page 12, which is the major expenditure requests. And our first is for IDPH, the electronic filing fee for death certificates. Oops. Yes, in the amount of $10,120. This was budgeted. This is our regular monthly expense. Do I have a motion to approve?
So moved.
Thank you.
Second.
Thank you, Angie. Do we have any questions or discussion concerning this? If none, all in favor, signify by saying aye.
Aye.
Opposed? Expenses passed. The second major expenditure request is from Northern Illinois Public Health Consortium, the 2021 membership dues. That is found on page 17. And that is in the amount of $24,960. This is a budgeted item.
The amount is 5,000.
Right.
I'm sorry.
Yeah.
James, thank you very much.
It's a very expensive membership.
Yeah, well, that was going to be on my question. Okay. So I will redo that. We have the expenditure request for the Northern Illinois Public Health Consortium membership dues for 2021. It is $5,000, leaving a balance remaining in the account of $24,960. This is a budgeted item. I have a motion to approve.
So moved.
Second.
Thank you. All in favor, signify by saying aye.
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 Aye. Expenditure is passed. I think we lost Sandra. She may be laughing so hard. We will move on to proposed contracts and agreements, which is page 21. Yeah. Let's see. And our first is the Erickson Institute DCFS Early Childhood Program. It is a new contract. There is no actual amount. Oh, okay, this must be for COVID, Child Education Home Visiting Program. Sandra, can you give us a little insight?
Yes, this is for referral of children through the this particular program to the home visiting program.
So will this be a
This is-
on-site visiting, or is this through Zoom, or?
It can be a combination of both. We are conducting, well, this is through the Erickson Institute. What it is that they agreed to participate with the McVie program, which we coordinate, so that when a child is found that's requesting or needs home visiting services, the McVie program coordinates them to the appropriate participating entity. So some programs are still doing home visiting during COVID with appropriate, social distancing and monitoring. Others are doing by Zoom chat. Most of us are doing a combination to get those home visits encountered. And it was interesting, and I'll talk about that later, but Kim Nelson was talking about the RPS 205 and more of the early childhood that they're doing via Zoom, classroom kinds of activities, and they're getting a little more interaction with families as well through this process. So things that were a little more challenging, or maybe we thought had some more challenges to doing, have not been. But this is a new participant in the McVie home visiting program. It's through the Erickson Institute and DCFS. They funded them to provide home visiting. This is agreement with our McVie program to coordinate that coordinated intake for all of our home visiting programs.
Thank
Okay.
you. Do we have any further? We had a motion and a second, did we not? I believe so.
I don't think we had a
Okay.
motion.
Then do I have a motion to approve?
I move that we approve the maternal, infant, and early childhood education visiting program with a correlation with the Erickson Institute.
Do I have-
Second.
Thank you. Do we have any further questions? If none, all in favor signify by saying aye.
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 Opposed? Agreement so passed. Bless you. Our second is through the Rockford Park District Teen Pregnancy Prevention in the amount of $3,000. This is a new contract. Sandra, can we get a little insight?
This is a continuation of the teen pregnancy prevention. Last year that kind of got halted when the COVID started, and we're part of that demonstration grant. And this is with the Rockford Park District to conduct the curriculum with their youth group.
And it's new this year because someone else did it last year, or?
Correct. I mean, actually, we were much more involved in the public school systems. They have not wanted to take on some additional activities during the school year. So we had to reach out to other groups where we could do the teen pregnancy prevention. piece.
I see. Okay, thank you.
Many-
Excuse me, if it's through the park district, how do they contact these children, or how do these children contact them?
Some of these, again, are being done virtually through their groups, or they're small. Some of them still are allowed to continue. When I say allowed, part of it, if they're in a small cohort group, they can continue to meet in their small cohort associated with that. So it's going to be under 10 individuals at kind of a facilitated, they don't break the cohort during all of this. So this may be a combination of both in-person and remote.
Thank you.
So do we have a motion? We have a motion and a second for this contract?
I move,
Thank you. Second, thank you.
Yep.
If no further discussion, all in favor, signify by saying aye.
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 Aye. Opposed? So passed. Our final pros contract is with multiple vendors. It is for community site COVID-19 vaccine administration. And does this tie in with the
Distribution?
distribution breakdown which we received last week? I'm sorry.
No. No, it's not. It is tied to, as we move forward, to do community-based vaccination efforts. So we're getting ready to start that process. So let's say we're going to do it at a church or at, one of the, just like we do for flu clinic. If we decide we're going to do it at the fairgrounds, or we're going to do it at one of our community centers in Rockford, we're going to, from our targeted, this is the site agreement that Charlotte and I have worked on to develop, so that when we're ready to begin that process, and we will get an agreement to be able to provide vaccinations on that site in that physical location.
Okay, thank you.
Question. So what exactly are we approving tonight? Are we approving the template
The template.
for that agreement? And when the different sites are identified, then we will be approving those individual sites?
No,
Or will having approved the template allow you to just go ahead and with each of the sites?
correct. So you're approving the template tonight. We'll certainly keep you informed of the sites that have signed on to the template or that have been chosen, because obviously that's very fluid right now. And this is really being proactive to move it forward. So as we approach sites that are really part of that whole vaccination planning team, that they would be able to present with them an agreement that, they can then take to their boards to approve the site being on their location, or, the vaccinations being given on their locations.
Got it. Really appreciate the proactive nature of what you're doing.
It's going to be a long time, but we got to give people the optimism and the hope.
That's right.
Is there a minimum or maximum number of sites we are hoping to get?
No.
Okay.
And again, the idea being that we will continue to vaccinate. I think we have to be clear with the public as well, that the first go around is very restricted, right? So hospital delivery, which we have not received yet, but we have allocated based on the numbers that they gave us and based on our hospital partners. The first will be the in-hospital healthcare workers only in this first. And again, because of I know this is kind of an odd one for the finance, but very narrow temperature range for keeping that vaccine, the way that it's going to be shipped to us, and the way that the receiving site at the state is going to open those boxes. So the clock starts ticking almost immediately. So when they get their allotment, they have 5 days in which to draw down that vaccine. So these sites will be much longer in the process, partly because we'll have hit the priority groups that we can control the vaccine supply in a much more tight fashion, given those control parameters. But this will be as we get more product out there that only needs refrigeration or maybe even just freezer versus super cold. And I do understand, Dr. Halverson, that the Dental Society is working on its Practice Act to allow dentists to be vaccinators.
Oh, that would be excellent. When that gets to that point, I would be more than willing to volunteer to help of the health department if that is needed, or any of the sites.
And again, we say, if you can do 2 hours, you can help us out.
All right. I know we ordered some, or approved the purchase of some storage and transportation containers. I'm not sure if it was specifically for the vaccine. Were any of them the refrigerated ones that we need? Because it doesn't have to be 95 degrees below zero for this initial. Is it the Merrick vaccine?
Well, so Jim and I were just kind of, we purchased those Vericore coolers that really maintain temperature of refrigerated vaccine. This vaccine will be thawed, right? So in order to administer it, you have to thaw it. So this
Right.
cold chain, which is the Pfizer product, is probably the one that's going to be released. When I say probably, it's being heard by the FDA tomorrow, right? Yeah, so everyone knows that, this isn't a mystery. This is the one that the UK started with. Which is why it's going to go to limited distribution. So for instance, you're going to give them in hospitals that can vaccinate large numbers of people in a short period of time, right? So healthcare workers in those institutions. It's not good to take to an offsite, but these coolers, we are deploying our coolers. So when our shipment comes, we will be breaking apart our shipment to the apportionment for our 3 hospitals based on numbers they submitted to our planning team. And then they will take those coolers, because they have monitors on them, into their pharmacies, and they will begin their vaccination efforts. Moving forward, most of these locations will be what we call direct ship from the vendor. So Ella McKesson, I believe, is their contracted pharmacy vendor at this point, will ship directly to those sites. We all had to register up in what's called the iCare system. We will not, the health department itself will not receive vaccine doses in this first shipment. We are the recipient, but we are allocating to the hospital immediately. Pharmacies that are going to vaccinate in the long-term care facilities, like the Walgreens and CVS, who have a contract through the Centers for Medicaid and Medicare, will also be getting their direct ship to start directly in those facilities. That looks like that'll be the following week. But this is all rapidly evolving. I don't know if it's evolving or devolving, but we'll say evolving for now, because there's lots of all the theories and things that we were told before didn't really happen. So the challenge will be maintaining the super cold moving forward. But 2 of our healthcare facilities do have super cold chain capability, but that's why they're getting, when you think about some of these facilities who may not, like, you may hear that Boone County is not getting an allotment in this one. If you saw the press conference, it's because Boone County doesn't have the capacity to use 975 doses in a healthcare facility providing care, right? So, and I don't mean to talk about them, but I'm using that as an example because someone called and said, first of all, we were one of the top 50 in terms of death rates. So that's, our death certificate numbers, you can see we're up. But the challenge is you've got to use that vaccine in that very short window of time, which is why you've got to have a fairly good volume to vaccinate. So again, it's not for the general population at this time. We're going to learn more about this vaccine product tomorrow. We've heard a little bit about the UK experiences with some anaphylactic reactions that you do have to be monitored for 15 minutes post receipt of this vaccine. And we said for most healthcare workers, that means you'll go back to your floor, your duty, your responsibility, and be monitored appropriately by your colleagues. It's a contained and controlled environment versus a car where I have to make sure, you don't leave the site or the location. But, that's why they're very prescribed about this. And, we know healthcare workers are better at monitoring their side effects and things like that. So hopefully this will roll out and we'll continue to be able to expand. And as more product becomes available with less, I'm going to say, extreme temperature and storage conditions, we'll be able to get that out to larger quantities of people. We do have a vaccine plan. It was submitted to the state last week.
This is the one that Rebecca submitted?
Yes, and you were copied on it.
Right.
And again, it's not for public distribution yet because it hasn't been approved yet by the state.
Excuse me, Sandra.
Mm-hmm.
I do have to be excused. Are we going to vote on this right now?
Oh, the agreement. Yeah.
I apologize. Did I have a motion in a second?
I move that we accept it as presented.
Second?
Second,
Anyone? Okay, we have a motion and a second. uh, For the community site COVID-19 vaccine administration agreement. All in favor, signify by saying aye.
Aye.
Opposed? So passed.
I'm sorry to interrupt, but the last page, do we need to vote on that too?
Grant, go to page 38.
Acceptance of the grant, Jim.
Okay,
Yeah, that's a continuation of our HealthWorks lead agency grant managed by Illini Care. And it started as of September 1st. So we were issued a PO by Centene. I have limited documentation on that, but I have been able to invoice and actually receive funds. So we billed under our normal circumstances to DHS for July and August, and then September, October, and November, we billed under this Illini Care through Centene. So
Jim, I believe we approved the grant. This was, the HealthWorks grant was transitioned from DCF, really from to Centene, which is their Medicaid managed care over larger financial corporation over what was Illini Care.
mhm. Yeah, at one point we had 6 months when they were doing the transition, but now we have a year. So we're funded through I think August 31st of 2021 based on this.
so there's nothing to vote on this. This is FYI, is it not?
Yeah, I believe so. Right.
So,
Okay.
okay, Angie, I think we are good.
Good,
All right, thank you for coming.
thank you. But I do need to be excused, so if you have more to discuss, I'll talk to you later on it, okay?
Thank you. Okay. Let's see.
So, and I guess if that's the official part, then you did get a copy of the vaccine plan, so you can take a look at it, light reading.
Oh, it's brilliant. It's a lot of pages, but it's very well thought out.
Well thought out. Well thought
There's-
out.
But you know what, there's still, every time we look at everything, oh, we didn't think that, we didn't plan that.
But you've got to get that kind of document in its, initial form in order to tweak it along the way.
And the phases are changing as we speak and as we live. But I think it'll be very interesting. I think this will probably be one of the greatest efforts, I'm going to say in my public health lifetime, the number of people that need to be vaccinated and the effort it will take, and it will not be overnight. And that's I think that's the heartbreaking part for people. They'd like it to be done in time to wrap up a bow on December 24th. And we're not going to be there. Maybe July 4th would be.
I was thinking about a 6-month period.
Celebrate our phase, but there'll be many of you will be able to get it through your physician's offices, right? Your practice areas. This will be a little bit different than you've seen in past, where public health would go out and do mass vaccination campaigns, because if you notice, we didn't call ours a mass vaccination. We're calling it a PopVax plan, because we don't want to get any big groups of people together. So, things like, right, yeah. So people like Oak Street Health will be vaccinating their own populations. Crusader will be vaccinating their own populations. Your healthcare providers at Swedish American and, OSF and Mercy will attempt to vaccinate within the practice setting, so that we don't end up, which is much more private, one-on-one kind of, scenario. We will have community pop-ups to ensure that individuals who do not have access to primary healthcare providers on a regular basis, or it's not convenient, or choose not to participate, some of our smaller providers may not be able to enroll, or we already have vaccine providers that don't enroll. So we'll be working with them to, be able to try and catch everybody that anyone who wants a vaccine will get a vaccine. So you'll see us going into employment places, the schools. The school nurses will be very much engaged with responsible for vaccinating their staff in those buildings. We're going to be working very hard to protect those who are going to be working with the much more vulnerable and critical populations.
Last board meeting, we talked, I believe, about a possible presentation about the distribution infrastructure and how it was in the plan. Did you decide whether that might be appropriate at this board meeting?
I think that, well, I think we certainly can do a high level overview with Rebecca. Will kind of lead that discussion. And then we'll also have our November data to share as well. It's obviously been a lot of life's work over the last, so definitely some high level overview. We're not going to get a whole lot into detail at this point because we probably won't know much more detail. We may know when it's coming to the hospitals, but we're very cautious about what we can share on that right now because obviously we have to have security plans and all that kind of, unfortunately, things in place to make sure that the vaccine gets to the appropriate location during this very challenging time for everybody. But you may want to, if there's a particular section too, I say invite the question that you want to be highlighted, but she will provide an overview. We'll make sure that that's on the agenda.
Okay. I mean, just what you were explaining about, the practice settings and whatever, I think all of that is very useful information. So however, we get just our own overview of it would just be really helpful.
Oh, agreed. This is, I feel like we could use a lot more meetings, but I don't think any of us can.
Not looking for any more meetings.
We're trying to, but again, things are rapidly moving at this point, which is, I think, probably one of the greatest, this will be one of the better achievements of this whole, is the really, I can't think of, you think about the development of polio vaccine and how long it took, the race to that, and the benefits of those of us who were the recipients of those vaccines. And now I think, wow, look at this. We've got even just understanding the types of vaccine that are out there, the messenger RNA types versus it's amazing the technology that is in a short timeline. But, and then whoever thought we'd be doing anything at -70, but, And I'm sure we've we'll may even have some pictures of what it looks like.
Pictures. All right. Pictures. I love pictures.
They're showing us these boxes. I'm like, oh boy, it's a box. I haven't used dry ice since what I'm trying to think when we made volcanoes in school, that dry ice, like, oh, we had to find a dry ice source. I'm like, oh.
Well, thank you again for all that you and the staff are doing.
It's a tremendous lift. They're doing a great job. I mean, it's a lot of work. And then Jim makes sure we are, that we're ordering and making sure we're financially stable during all of this, paying all the bills, making sure we're collecting all the fees and monies. As I said, when you realize you don't even know how much staff are really here at times. I mean, it's not because you don't appreciate them, but we're also in really tight when I say tight quarantine, we're not getting out of our offices, and we have a lot of staff that are working remote with all the technology related to contact tracing. I mean, a huge effort. And so we'll get a lot. And for those of you who probably have been watching, we'll give you a little update too. We are not changing our quarantine guidelines at the present time. Our team has looked at that. I have concerns about asymptomatic transmission and the ability to really manage that. I'm going to say that time frame and keeping people monitoring themselves, clearing them appropriately, and then getting the right test, because it's a lot of confusion out there. You cannot release yourself you can't have an antigen test. So it can't be one of the rapid antigens that we have out there. It has to be a PCR test. So that creates a challenge because those take 2 to 3 days to get them done. So it'll be another, It's very interesting that the group felt like at this point, which is a little different than, not every health department is adopting and some are going in different directions, but very challenging time in this, but everyone stay safe. We're optimistic. We're seeing some light at the end of the tunnel. We just got to get to the tunnel.
Okay. Since we happen to be in the finance committee tonight, and I was talking about overall in terms of staff and just thanking you all for what you're doing, just want to say a thank you to Jim, since we are in the finance committee and all that you're doing, you know, as Dr. Martell was saying, to keep us financially pulled together at this point. So,
Okay, well,
just-
thank you. You get a
So
lot of
thank you.
support, so appreciate it.
okay, well, support is what it's all about.
We always say, Jim, do we have it in the bank?
Actually, we do. All right.
Today we do.
Yeah, today, we just gotta keep it there.
I know last month we talked about bringing to the finance committee approval of a potential information system to support vaccination. And that was one of the late breaks that we learned from the state, that they're actually pulling through a vendor to provide at no cost, but that doesn't necessarily mean it will meet our needs. So Jim's been trying to work through to see if our contact tracing monies that will not be expended by December can be used for that. We have not heard back yet, but he's been working through that as well. So we did not bring it forward because I don't want to put us on there, because these systems are not cheap, and you know, we certainly don't want to waste any kind of funds or monies, but if it's reimbursable, we might consider something that we know would be dedicated to working with us.
Great. All right.
All
Excellent.
right.
If we have no other business, I will ask for a motion to adjourn.
So moved. We'll have to wait for David to sort of go yes up and down for a second.
Okay. Oh,
Okay, we got a second. Yes.
We're having sounds issues tonight. We're gonna have to work on this.
all in favor of adjournment, signify by saying aye. Aye. Opposed? We are adjourned. Once we are disconnected from live, you can just signal me, Christina. I have a question, Sandra.
All right.